Good afternoon. Welcome to the Supporting Families Through Best Practice, an overview of the standards of quality in family strengthening and support. My name is Jennifer Johnson Dungy, and I am the National Parent Leader and Training Development Manager for the National Family Support Network. I will be your presenter for today's webinar. If you are joining us online, you may listen directly through your computer speakers. And if you have joined via the phone number that Zoom provided, your line has been muted to minimize the background noise. You may put any questions that you may have in the question section at any time. The chat section is open for you to include any comments during the webinar, but we ask that you direct all your questions to the question and answer section of Zoom. Live tech support is in the room. If you have any technical issues, please reach out to them in the chat. Felipe will always be available. Today's PowerPoint, the handouts, and a recording of this webinar will be available on the NFSN website on the Webinar Wednesday page by this time tomorrow. So when you exit the webinar, please complete an evaluation, which will automatically appear on your screen. We ask that you take a moment to complete this as it provides us with valuable feedback to inform our future webinars. So now we want to know, where are you joining us from today? So Felipe, thank you for pulling up that poll question. Where are you joining us from? Are you joining us from the Northeast, the South, Midwest, West, Canada, or other? We'll give you a couple of seconds to complete that. All right, Felipe, will you go ahead and close that poll for us? Let's see. A whopping 37% of us are joining from the Midwest, followed by a tie for 26% Northeast and West, and then 11% from the South. So we have a good range of people from all over here today. And we're super excited because the wealth of knowledge that you bring to the table is always important. So again, thank you for joining us from all the different areas of the United States. We definitely appreciate you. So let's get into National Family Support Network. So over the last decade, the National Family Support Network, also known as NFSN, has quadrupled in size. We now have 41 member networks, which includes 40 states and DC. And those 41 networks represent more than 3,000 family resource centers that serve more than 2 million people annually. Our newest members, they just recently joined as of last week, are Oregon. So we're super excited in February of 2025 to welcome Oregon to our NFSN member network. What is the mission of NFSN? So NFSN the mission is to promote positive outcomes for all children, all families and communities by leveraging the collective impact of state family resource center networks and championing the quality family support and strengthening practices and policies. What is our vision? Our vision is about turning the whole map green so that all families have access to quality family support services in their very own communities, provided by family resource centers who are supported by strong networks. So what are our areas of work? Our areas of work, one, is connecting and convening member networks to enhance their effectiveness. So increasing connectedness amongst members for peer learning and for mutual support. We also work to promote family support, best practice, and evaluation. So we raise awareness of what quality family support is and promote a common language, standards, and evaluation of it through the national implementation of the standards of quality for family strengthening and support. Lastly, we raise the visibility of the value and impact of family strengthening and support networks. So in order to strengthen and increase support for families. So today our agenda is that we will go over the background of the standards. Where did they come from? We'll talk a little bit, we'll go do an overview of the standards, high level. Then we'll talk about standards implementation from a programs level and a systems level. We'll have a time for question and answer, which you can still put in the question and answer section. We'll also go over some resources and opportunities that are available. And then we'll talk about evaluation. So focusing on the families, our focus is on families who are responsible for raising children. These families consist of at least one adult and one child who are related biologically, emotionally, or legally. Families may consist of one parent, two parents, grandparents, foster parents, legal guardians, or they may arise from a need for mutual support. Let's look at a timeline of our standards. So in 2012, the California Network of Family Strengthening Networks developed the standards of quality for family strengthening and support. In 2013, NFSN adopted the standards for national implementation. And then 2020, just 5 years ago, NFSN engaged member networks across the country. We engaged parent leaders, Canadian family support organizations, and the Center for Study of Social Policy to really review and revise the standards with a focus on diversity, equity, and inclusion, and the relevance for both the United States and for Canada. And then in 2021, our new version was approved by the NFSN membership. What is the importance of standards? So the standards really help ensure that families are supported and strengthened through quality practice. The standards help create a common language and expectations across different kinds of family strengthening programs. The standards was designed to be used by all stakeholders, whether you work for a public department, a foundation, community-based organizations, and to be used with families. This is a tool for planning, providing, and assessing quality practice. Standards and all implementation tools are available for free download on the NFSN website, which is www.nationalfamilysupportnetwork.org/standards. We don't sell the standards. We want everyone to have access to them so that you can think about quality work with your families. Let's talk a little bit about application of the standards. So where are you applying these standards? We want to know, what is your affiliation? Are you a family resource center? Are you a family resource center network? And Felipe, if you'll go ahead and launch that poll. Are you another type of family support program? Maybe you're a parent leader. Are you in early care and education? Maybe you're in education, government or child welfare, government other, private funder, or other. And if you are other and you feel comfortable, we would love for you to drop into the chat what those others are. We definitely want to know everyone who is in the room and what their affiliation is. So I'll give you a couple of seconds to answer that. All right, Felipe, can we go ahead and close that poll, please? Thank you. So in the room, we have 32% of you all are a part of a family resource center. And then we have 18% are other family support programs. If you haven't already dropped into the chat, please drop it into the chat. We want to know who that is. 18% are in education, followed by 9% in government other, and 5% of family resource center network, or 5% also government child welfare. And we have parent leaders in the room. We have 5% parent leaders. So amazing, amazing numbers. Again, we look at this because it's important. We want everybody to be able to take the standards and apply the standards, right? Depending on where you are, we have space. If you're direct service staff, reflecting on and enhancing your work with families, right? If you're policymaker, you can apply the standards by endorsing for application in your areas of influence. If you're a family or parent leader, you can partner with programs to apply the standards, to provide feedback about how well program is applying the standards. Maybe you're the Family Strengthening and Support Program. This is a blueprint for implementing best practice. You can do a self-assessment to see where you all are on the continuum. This also helps demonstrate quality. So no matter where you are in applying the standards or what your affiliation is, we want everybody at the table. So, program application of the standards. I want to know, and we want to know here at Innovation, what level do you work at when we're looking at applying the standards? So, are you a policy or systems level? Are you management level, program direct service level, or other? And if you have other, we would love to see that in the chat. Give you a couple of seconds to answer that question. Awesome, Felipe. Will you go ahead and close that for me, please? Let's see, 45% are program or direct service level. You are working directly with our families. So kudos to you and all the amazing work that you do. And then we have tied for 18%. We have the policy systems level, we have management level, and we have other. What I want to highlight is we have someone from every single category, not just a single someone, multiple someones from different categories here. And it'll be super important as we look at applying the standards. So applying the standards really takes a commitment of not just one group of people, not just direct service staff. It takes the commitment and support of all levels of program responsibility. So we're talking about executive directors, we're talking about managers, coordinators, direct service staff, parent leaders, families, funders, all of those things. We want everybody at the table when we talk about applying the standards. So how did the standards come to be? What are some of the foundational frameworks? So the standards were brought together by two foundational frameworks in the family support and strengthening field. Those frameworks are the principles of family support practice, which is developed by the Family Support America, and the Strengthening Families Protective Factors framework and approach. This was developed by the Center for the Study of Social Policy. It is research-based and evidence-informed, and the standards really uniquely integrates them and operationalizes the standards through the framework. Okay, so principles of family support. Maybe you've seen this, maybe you haven't. We want to know. So Felipe is going to launch this poll for us. How many of you have heard of the 9 principles of family support before today? Have you heard them? Yes, or maybe you haven't heard them. So it would be a no. We'll go ahead and take a couple of seconds to answer this question. All right, Felipe, let's go ahead and close that poll. And let's see, we are tied. 50% of us are familiar or have heard of the principles of family support, and 50% of us have not. So the principles of family support were developed again by a national organization called the Family Support America. They were developed in 1981, and they still continue to guide and frame the field today. Let's talk about the first principle. Principle number 1, staff and families work together in relationships based on equality and respect. While this principle may not seem so revolutionary today, at the time it was written, it presented quite a challenge to the system. At the time, the prevailing wisdom was that staff were the experts, and with their education, their knowledge, and their experience, their goal was to fix the problem. Family, right? That's what they wanted to do. But this principle, it challenged that notion by saying staff and families are equal, right? The staff come to the table with their education, the staff come to the table with their knowledge and their experience. But guess what? The families also bring their own strengths, right? The families bring their own resources and are the most knowledgeable about their own past experiences, right? So it is by working as partners in relationships based on equality and on respect that we really really truly achieve the best outcomes for that particular family. Principle 2 talks about staff enhancing families' capacity to support the growth and development of all family members, adults, youth, and children. This principle, it really emphasizes that we in the family support field, we look at the whole family, not just the individual, right? If only one member of the family participates in our activities, we want to be asking about and inviting other members of the family as well. We know that when multiple family members are involved, the family will be more likely to have better outcomes. And then principle 3, families are resources to their own members, to other families, to programs, and to communities. So very unique to the family support perspective is that we do not see staff as having all the answers or doing all the work to support families. Families themselves are encouraged to support other families, to build those connections. There is a strong emphasis on connecting families to really share resources such as information and to have that peer support. All right, principle number 4. It talks about programs affirming and strengthening families' cultural, racial, and linguistic identities and enhances their ability to function in a multicultural society. So this principle is really commonly referred to as our diversity principle. It has two parts. So the first is about respecting and welcoming the cultural diversity that families bring. But then also the linguistic diversity, the cultural diversity, the family structure, all of that. The second part is about preparing them for and connecting them with the larger community where they will naturally interact with people very different from themselves. This will support them to fully participate in our diverse society in which we live. Principle number 5 talks about programs embedded in the communities and contributing to the community building process. So, family support programs do not see themselves simply as a social service provider, but as community builders as well. By strengthening families, they make a key contribution to the health of the communities they're in. They also work to develop families' responsibility and leadership for strengthening and building their very own communities. And then we look at principle 6. Principle 6 talks about programs advocating with families for services and systems that are fair, that are responsive, and accountable to the families we serve. Think about some of the major systems that families you commonly interact with, may come in contact with: education, healthcare, legal system, housing. Are all of these systems fair and responsive? Are all of these systems accountable? Unfortunately, often they're not. That's where our work comes in as family support providers, to work with families to really help improve these systems, help these systems become fair and responsive, help these systems become accountable. And then we look to principle number 7. Practitioners work with families to mobilize formal and informal resources to support family development. So there's a strong emphasis in the family support field on resources. The most common type of family support program is called a family resource center. So there you see, right in the name, the emphasis on resources, right? And while no program could directly provide all of the supports a family might need, it is our responsibility to know how to connect them to the resources that they do need. And then principle 8, it talks about that programs are flexible and continually responsive to emerging family and community issues. We've seen this over the years. We've seen it with COVID. We've seen it with the hurricanes, right? Programs needing to be flexible and continually responsive to what issues emerge in their community and emerge with their families. The concepts of flexibility and responsiveness are very important in the family support field because neighborhoods and communities change. A neighborhood that is majority today Latino may be majority Asian in 5 years, right? Issues emerge that significantly affect families, such as the economic downturn, Programs need to be flexible. Programs need to be responsive to these changes. If you can think of any programs that or examples, feel free to drop it into the chat. Times where you may have had to be flexible, times where you've had to be responsive as a program. Feel free to drop those into the chat. Principle number 9. Principles of family support are modeled in all. Can I say that one more time? Principles of family support are modeled in all program activities, including planning, including governance and administration. This is the catch-all principle. It's one of my very favorite principles because it says that all of the above principles should be applied in every single thing that you do. Planning, governance, administration. These principles have implications for how we develop programs, how they are led, and truly how we support our staff and meet our families. I'm going to have Felipe launch another poll. Have you all heard of the protective factors before today? If you'll go ahead and answer yes or no, that'll guide us into our next conversation. Have you heard of the protective factors before today? Yes or no? Give you guys a couple seconds to answer. All right, Felipe, let's go ahead and close that poll. All right, y'all. 59% of us, yes, have heard of the protective factors before today. 41% of us will get a little brief overview, but definitely encourage you to look into learning more about the protective factors framework. The Strengthening Families Protective Factors framework was developed by the Center for the Study of Social Policy in 2005. They are research-based and evidence-informed, and they really work to increase family stability. It enhances child development and reduces child abuse and neglect. So why aren't we using these frameworks, right? So the 5 protective factors that are in the protective frameworks are parental resilience, social connections, concrete support in times of need, knowledge of parenting and child development, social and emotional competence of children. If you want more information on the 5 protective factors, please look at this website that's on your screen, ccsp.org/our-work/project/strengthening-families/. It is a great resource for more information. So the standards has 5 sections, and each section represents key elements of quality practice. So the 5 sections are family centeredness, family strengthening, diversity, equity, and inclusion, community strengthening, and evaluation. The standards structure has 15 standards. The standards each have indicators. Each standard includes 1 to 2 sets of indicators of both foundational quality and high quality. The foundational quality indicators demonstrate the basic application of the standard. If you are just meaning the minimum, that's what it's saying. Programs then are able to build upon the foundational quality indicators to achieve the high quality indicators, which represent deeper integration of the standard. Each indicator is followed by 2 to 4 examples from the field that illustrate its application. These examples are provided as illustrators and are not meant to be a checklist or limited to the one cited. So in the certification trainings on the standards, a significant focus is on participants really thinking of their own examples that really demonstrate the indicators in ways relevant to their very own programs. And as programs apply the standards, they are encouraged to identify their own examples that really demonstrate the indicators in ways that are relevant to their own communities. So quality indicators. So foundational quality indicators create a solid foundation for family support and strengthening programs. The foundational quality indicators are designed to be met within the basic resources of a typical family support and strengthening program. High quality indicators are built upon foundational quality being in place first. We don't just jump to high quality. We need that foundation under us first. Programs are encouraged to strive to meet those high quality indicators in order to serve families most effectively. So some high quality indicators may require capacity building or additional resources to be able to meet those high quality indicators. So let's review the progression of the quality continuum. So we start with foundational quality, not yet addressed, and then we approach foundational quality, then we meet foundational quality, right? This is where quality really begins, when we meet it. Then we continue along the continuum to approach high quality and meet both foundational and high quality indicators. You'll see at the bottom that the arrow keeps going. And after we have already met foundational and high quality. Why, you ask? Because this is because quality improvement is an ongoing, continuous process, right? We say that high quality is not maximum quality, that there will always be room to continue to grow and improve. So then we look at moving from foundational to high quality and what that looks like. So for the first 4 sections of the standards, this is an arrow we use to explain the movement from foundational to high quality. On the left, we see foundational quality, and on the right, we see high quality, which represents the deeper integration of the standards into the program that we've been talking about. What moves foundational to high quality are the elements in the arrow in the middle. So formal structure, such as, do you have design? Do you have policies? Do you have procedures and intentional strategies with committed resources that can ensure the consistency of the practice? Staff training. Do you have staff trained to support the implementation of the standard? Family partnerships, super important. Partnering with families in the implementation of the standard. Each of these elements helps ensure that the standards are more deeply integrated into the program practice. For example, at foundational quality, we may do something that is good practice, right? But how do we ensure that it wasn't just a one-time occurrence, a one-off? At high quality, we have set up systems, training, policies, procedures, and have partnered with families to ensure that it will continue to happen. The particular elements and number of elements needed for high quality will differ for various indicator pairs. So sometimes you only need 1, sometimes it's 2, sometimes it's all 3, but it is never anything other than those 3. So let's review the family centeredness 1 standard. So the standard says program engages families to participate in program development and implementation. The foundational quality indicator is that program solicits input from families to shape and plan the program and services. The high quality indicator would be that programs design supports partnering with families to have an active role in the development and implementation of the program. The difference between minimum and high is it really looks at like the words and the arrow elements. So as you see in the arrow, formal structure and family partnership are the elements that will move us from just being foundational to moving to high quality. So here you're going to see the evaluation arrow. Okay, as with the arrow we use in the first 4 sections of the standards, we see foundational quality on the left and then a high quality on the right, which represents, again, the deeper integration. But the elements in the arrow are different. The elements that we have here are going to be data analysis. So you're collecting data is foundational, but analyzing the data is what moves us to high quality. Sharing evaluation results with various stakeholders, such as the families we work with, Program modification means changing the program as a result of what we learned from the evaluation. We don't just do evaluation for evaluation's sake. We actually do something with it. Again, that helps with the deeper integration. So let's read the program self-assessment tool. The program self-assessment tool is designed to be used as a critical thinking exercise by program teams, managers, whether it's direct service staff, parent leaders, the whole team, and it's designed to be used together. It is recommended that all team members involved in using the self-assessment tool have been trained on the standards first. Then you look at the staff self-reflection tool. This tool consists of 15 self-reflection questions for staff members to use on an ongoing basis as a reminder of how to implement the standards. Staff are encouraged to put it in place that they can see it regularly. Is it on your wall? Is it on your desk? So again, you can see it regularly and utilize it as you implement the standards. And then we have the standards participant survey. The standards participant survey shows how well the program is meeting the standards from a participant's point of view. It is not a typical satisfaction survey. The questions mirror those on the staff checklist. So if staff members are mindful of these questions, the program participants are likely to give the programs high scores. So all of these tools are available on the NFSN website and are included in the standards training. So again, you can go to www.nationalfamilysupportnetwork.org to get those tools. So training is a fundamental strategy for implementing the standards effectively. We are so glad that you are here for this webinar, but just as a reminder, this is not the training. In order to receive a certificate, you'd want to participate in the certification training. Certification trainings are conducted by pairs of trained trainers from member networks of the National Family Support Network. Certification trainings are in-person or virtual trainings and designed for all levels of staff or people who engage with families. Participants will receive a certificate that is valid for 2 years. Networks, funders, and other stakeholders can also contract with the NFSN to host a certification training for programs in their area if there are no standards trainers in that state. Programs are highly encouraged to come as teams of both management and direct service staff to the training because successful application of the standards requires the commitment and support of all levels of program responsibility. Individuals are certified, not organizations, which integrates the standards into everyone's daily work and provides a professional credential for staff. All trainings are live because the group work and peer sharing are extremely valuable to the process of learning about the standards. So let's talk about the Training of Trainers Institute. The Training of Trainers Institute is a 4-day in-person or a 5-day virtual training for representatives of NFSN member networks to be able to conduct the certification training in your area. Only network representatives are trained to be trainers, which supports their capacity building and establishes a unique and essential and ongoing role for them within the support system for families in their area. So here you see nationwide from May 2012 to December of 2023, and we will actually be updating the slides soon. I know Felipe works really hard on making sure our numbers are great, but you can see the average evaluation scores, most overall satisfaction, 4.78 out of 5. The readiness to implement the standards is a 4.54 out of 5 after taking a standards training. You'll see all of our state networks and how many trainings, individuals they've trained, and the current number of trainers. And again, this will be updated to reflect 2024 as well. So let's talk about the training impact that you'll have. So post-certification training surveys have shown 91% of respondents indicated that the standards enhanced their program's work with families. At least 85% of respondents report using one or more of the standards implementation tools. So we've learned to really focus on a strength-based approach to working with families we serve, as well as our coworkers. We have learned to self-assess our center's services and welcoming environment and the ways we can improve in these areas. That was someone from Pittsburgh, Pennsylvania. I'll give you a couple minutes to read the quotes from across the country. So as you see here, the standards help validate existing work. They benchmark it to national best practice. So supporting network development. Networks formed and expanded through standard certification training. Networks strengthen capacity and sustainability through developing trained trainers. So for example, in Arizona, the standards, it provided a common language for diverse providers across the state, and it established a key role for the Maricopa Family Support Alliance in promoting quality practice within the system of care. As a result, the alliance grew from 21 to 72 agencies in just a few years. Let's talk about networks being strengthening their capacity and sustainability. So in order to ensure the accessibility and affordability of the standard certification training, networks with certified trainers are able to charge participants within the range of $0 to $125 to conduct these trainings. All funds generated through standard certification trainings are invested back into those supporting networks. So here you see the program implementation continuum at program level. So just a high level, you see we go from prepare to promote, to attend a certification training, to implementing the tools, to developing program implementation plan, ensure ongoing quality improvement, ongoing training. You will want to see where you are on this continuum. Do you fall on prepare? Is this the first time you've encountered the standards, right? So maybe you're preparing and you're interested in hosting a training or going to one of NFSN standards trainings, right? This continuum is available for download in the handout section of the GoToWebinar console. You'll also see it dropped in and will be available for you guys for future. So then we look at it from a network implementation. So this illustrates just like a high level, you'll see, again, the same continuum of prepare. Where are you at in prepare? Are you downloading the standards from the website? Are you participating in a standards overview participation presentation today? Are you planning out next steps, right? Are you moving to promote? Are you inviting NFSN to present on the standards to your network? Are you encouraging stakeholders to review recorded standards overview webinar? And then you'll move into attending certification training. Are you oriented to using the standards, right? And the tools. Complete the certification training and become certified for 2 years. Then you move into hosting certification trainings, develop network trainers, developing a network implementation plan, and then implementing topical trainings related to the standards. So here's an example of a network implementation. So here you see the San Francisco Family Support Network. It's an implementation diagram from one particular network that really demonstrates how they implemented the standards as a network. They use a 3-pronged strategy that integrates them into training, evaluation, and membership. Each network is encouraged to develop their own network implementation plan. So this diagram, it illustrates how the Colorado Network has tiered their trainings for the Family Resource Center staff. All staff at the centers, regardless of roles, complete the 1-day standard certification training. Staff working with families and their supervisors complete the free 14-hour online strengthening families training offered by the Children's Trust Alliance. And then staff working directly with families in case management roles complete the 60-hour family development credential. So If you've sat this far, now you're saying, why adopt the quality standards? Let's talk about it. Some considerations we'll look at is, do you want to deepen your practice? Do you want to establish common language? How about developing partnership opportunities? Utilizing shared measurement across systems? Doing something concrete to really advance diversity, equity, and inclusion, and being a part of the national movement. Some of our suggested next steps are download the standards. So go to www.nationalfamilysupportnetwork.org, download the standards, review them, review possible next steps along that program or network standards implementation continuum. And then for funders in states without networks currently offering the standard certification training, review the standards training page to learn about how you can contract with NFSN to bring the training to your state. At this time, I will open it up to any questions that you may have had. Hopefully you put them in the question and answer. I don't currently see any, but I'll give you guys a couple of seconds to put any in there. If you have any questions, feel free to drop them into the Q&A or the question and answer section, and we can answer them for you. Well, since we don't have any questions currently, I'm going to go ahead and move on. But feel free that if you drop them in the Q&A, I'll also come back. All right. What do we have coming up here at NFSN? We have more webinar Wednesdays. I am super excited about the one coming up February 26th of 2025. It is at the same time, 2:30 to 3:45 Eastern Standard Time. This one is a community opportunity map provided by Casey Family Programs. It's a workshop on using data to engage communities and write grants. You do not want to miss it. Make sure to sign up today for that webinar, February 26th. Also, if you came to this and you have not participated in standards training, please look to your state networks to see if they have any trainings. But if your state network does not have a training coming up, please reach out to NFSN or www.nationalfamilysupportnetwork.org and you can register. We have one coming up March 11th and 12th. It is almost full, so make sure to get in there today. We also have our next one June 17th and 18th. The registration will close June 10th. Check our certification training page on the NFSN website to see if your state has a network that currently is offering the standards trainings in your area as well. And then we have the Developing and Sustaining Effective Parent Advisory Committees training. That is coming up February 18th and 19th. So next week, we have extended it to February 14th. We want you to register. We have just changed our name to the Parent Voices Matter, Cultivating Resilient Parent Advisory Committees. So please sign up for that training. We will see you February 18th and 19th. Register by Friday, February 14th. We also have one coming up in March 18th and 19th. Registration closes on the 11th. This is a unique, highly rated virtual training for program staff to maximize the great potential of having a parent advisory committee. This is co-trained by NFSN staff and an experienced national parent leader. If you have any questions about anything that we've talked about today or any of the trainings we provide, my name is Jennifer Johnson Dungy. I am the National Parent Leader and Training Development Manager for the National Family Support Network. Here you'll see my email address, jennifer@nationalfamilysupportnetwork.org, and my phone number, 512-375-5903. I look forward to connecting with you guys in future. Always feel free to send me an email or give me a call. I appreciate you all so much for being here today. If there is no questions, I'm going to go ahead and go to our next steps. So what are our next steps? Please take a few moments and fill out the evaluation that will automatically pop up on your screen when you exit. This includes questions about identifying your next steps and what would support with them look like. So please, as you exit out, please complete that survey. It'll also ask future webinar topics. Thank you so much for being here today. We truly appreciate you taking the time to learn more about the overview of strengthening family support standards. We look forward to seeing you future. Have a fabulous day, and we will talk to you again soon. Thank you so much, everybody. Have a great day.